Acute peptic ulcer disease. What is peptic ulcer? Let's review.
A peptic ulcer is a sore that develops in the lining of the lower part of your esophagus or various parts of your stomach or small intestine. A peptic ulcer in your esophagus is called an esophageal ulcer. In your stomach, it is called a gastric ulcer. When the ulcer affects the first part of your small intestine, called the duodenum, it is called a duodenal ulcer. When you eat, your stomach produces highly acidic digestive juices, also known as stomach acid, to help break down food. Then, the food passes into your duodenum for further digestion and subsequent absorption into the bloodstream. To protect your organs from the corrosive effects of stomach acid, a layer of mucus coats the lining of your stomach and duodenum. When the protective mucus layer breaks down, stomach acid can seep into the lining of your stomach or duodenum and cause an ulcer.
The causes are Helicobacter pylori bacteria, regular use of certain pain relievers such as aspirin and NSAIDs, and other medications.
The pathophysiology of acute peptic ulcer done by H. pylori infection. The gram-negative spirochete H. pylori was first linked to gastritis in 1983. It will produce urease that will alkalize its microenvironment and cause inflammation. When H. pylori colonizes the gastric mucosa, inflammation usually results. In patients infected with H. pylori, high levels of gastrin and pepsinogen and reduced levels of somatostatin have been measured. In infected patients, exposure of the duodenum to acid is increased. It will also impair duodenal bicarbonate secretion. The combination of these two will lower the pH in the duodenum and promotes the development of gastric metaplasia. Infection in this area will induce duodenal ulcer.
What is an NSAIDs? NSAIDs, or non-steroidal anti-inflammatory drugs, are a drug class that reduce pain, decrease fever, prevent blood clots, and in higher doses, decrease inflammation. Examples of NSAIDs are aspirin, ibuprofen, and naproxen. How NSAIDs induce peptic ulcer? Prostaglandins plays an important role in maintaining gastric mucosal defense system. Prostaglandin is being produced by an enzyme called cyclooxygenase COX, which consists of COX-1 and COX-2. Both enzymes produce prostaglandins that promote inflammation, pain, and fever. However, only COX-1 regulate physiological processes, such as gastrointestinal cytoprotection, which maintaining an effective mucous bicarbonate barrier, quicker and more effective mucosal adaptation to initial tissue damage. NSAIDs interfere with the COX pathways, primarily COX-1, which lead to deficiency of prostaglandins. Disrupt mucosal protection by reducing the effectiveness of the mucous bicarbonate barrier. Gastric acid and possibly also pepsin can come in contact with stomach wall as the mucus that protect the stomach from the acids are depleting, which can lead to ulcer and bleeding.
Clinical manifestation of acute peptic ulcers. Peptic ulcers may present with dyspeptic or other gastrointestinal symptoms or may be asymptomatic and present with several complications such as hemorrhage and perforation. One of the main symptoms of acute peptic ulcer is dyspepsia. You may have recalled the word with epigastric pain. It is an upper abdominal pain or a discomfort in which like 80% of patients with peptic ulcer were diagnosed to have this epigastric pain. Patients with peptic ulcers may have also food-provoked symptoms due to visceral sensitization and gastroduodenal dysmotility. The symptoms were postprandial bulking, epigastric fullness, early satiety, fatty food intolerance, and occasional vomiting. Classically, gastric ulcer pain increases while we eat a meal due to the physical presence of food and also the active secretion of hydrochloric acid in the stomach by the stimulation of the eating process.
Diagnosis and lab finding of peptic ulcer. Based on symptoms, doctor will task for H. pylori infection. First by using UBT, urea breath test, second by using stool antigen test, and third by using blood test. For detection of peptic ulcer, doctor will use gastroscopy. Patients do not have to stay overnight at the hospital. Gastroscopy is a thin tube with a tiny camera at the end will be inserted at the patient's mouth to view any peptic ulcer at duodenum and stomach. Lab finding, immunology tests will be H. pylori positive, Gregerson test positive, full blood count will show anemic sign and also inflammatory sign, biochemistry test high gastrin, low secretin, and somatostatin.
We move on to the treatment of peptic ulcer. The medicines given depends on the cause of peptic ulcer, which is NSAIDs-induced, H. pylori infection, or both H. pylori and NSAIDs-induced. For NSAIDs-induced, patients are advised to stop NSAIDs intake. They will be given proton pump inhibitors, histamine receptor blocker, and protectants to help the healing process. Next, doctors may prescribe triple therapy, quadruple therapy, or sequential therapy to treat H. pylori infection, peptic ulcer. If your peptic ulcer are induced both by H. pylori infection and NSAIDs, PPI or histamine blockers, and other medicines such as antibiotics, bismuth salicylates, or antacids will be given.
To conclude, every disease that we get is a test from Allah. He knows that we can endure this challenge and become stronger after experiencing this situation. So we must think that the disease is a sign that we must worship Him in every situation and condition. By remembering Allah, He will remember us. Surah Al-Baqarah verse 286. Allah does not burden a soul beyond its capacity. It gets the consequence of what good it has earned, and it bears the consequence of what evil it has earned. So, that's all from us. Thank you.